Please use subtitle translation to select desired language. Slow wave sleep, SWS, also known as deep sleep or delta sleep, is a crucial stage of the sleep cycle. Here are the functions of slow wave sleep. Physical restoration, SWS, is essential for physical recovery, as it supports tissue growth and repair processes. Hormonal release, the body releases growth hormone during this stage, facilitating growth and healing. Cognitive benefits, SWS plays a vital role in consolidating memories and learning. It helps process and store information acquired during wakefulness. This stage enhances creative thinking by allowing the brain to make connections between different pieces of information. Immune system support, slow wave sleep boosts the immune system, helping the body defend against infections and diseases. Mood stability, SWS can reduce the risk of mood disorders like anxiety and depression. Brain detoxification. During slow wave sleep, the brain clears out toxins and waste products, including proteins associated with neurodegenerative diseases. Metabolic regulation, SWS helps regulate hormones related to appetite, such as leptin and ghrelin. This regulation can help prevent overeating and support weight management. Cardiovascular health. During SWS, the cardiovascular system gets a chance to rest and recover, which can help lower the risk of heart disease and maintain healthy blood pressure levels. Reduced inflammation. Adequate SWS is associated with lower levels of inflammatory markers, which can benefit cardiovascular health. Brain development. In children and adolescents, slow wave sleep is crucial for brain development. Pain management. Adequate slow wave sleep helps improve pain tolerance and may reduce the perception of pain, benefiting those with chronic pain conditions. Hormonal balance. SWS helps regulate cortisol levels, the hormone associated with stress. Balanced cortisol levels can reduce stress and promote overall health. Mental clarity and focus. A good amount of SWS is linked to better focus, attention, and decision-making abilities during waking hours. Improved athletic performance. Athletes benefit from SWS for muscle recovery, energy restoration, and improved performance in physical activities. The amount of slow wave sleep, SWS, needed for optimal function can vary by individual and is influenced by several factors. Typical sleep cycle. A complete sleep cycle lasts about 90 minutes and includes several stages of sleep, light sleep, SWS, and rapid eye movement sleep. Most adults experience multiple cycles per night. Proportion of SWS. SWS typically constitutes about 13 to 23% of total sleep time for adults. This translates to roughly 1 to 2 hours of SWS in a typical 7 to 9 hour sleep duration. Age. Children and adolescents require more slow wave sleep for growth and development. Older adults often experience a decrease in SWS as they age. They need less but still benefit cognitive and physical health. Activity level. Physically active individuals require more SWS for recovery and muscle repair. Health status. Those recovering from illness or dealing with stress need additional SWS to support healing and emotional regulation. Sleep quality. The quality of sleep matters as much as the duration. Fragmented sleep can reduce the amount of SWS achieved. To increase the amount of slow wave sleep, SWS, you get each night, consider implementing the following strategies. 1. Prioritize sleep duration. Aim for 7 to 9 hours. 2. Establish a consistent sleep schedule. Go to bed and wake up at the same time every day to regulate your body's internal clock. 3. Create a relaxing bedtime routine. Engage in calming activities before bed, such as reading, meditation, or gentle stretching. Avoid stimulating activities that can interfere with sleep onset. 4. Optimize sleep environment. Invest in a comfortable mattress and pillows. Keep your bedroom cool, around 15 to 19 degrees Celsius. Use blackout curtains and white noise machines to create a dark, quiet environment. 5. Limit exposure to screens. Avoid screens, phones, TVs, computers, at least an hour before bed, as blue light can inhibit melatonin production, which is essential for sleep. 6. Avoid heavy meals before bed. Eating large meals can disrupt sleep. Try to finish eating at least 2 to 3 hours before bedtime. Reduce consumption of caffeine and alcohol, especially in the hours leading up to sleep. 7. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity each week. Try to finish vigorous workouts a few hours before bedtime to avoid disrupting sleep. 8. Manage stress and anxiety. Use mindfulness, deep breathing, or yoga to reduce stress levels, which can enhance sleep quality. 9. Get natural light exposure. Spend time outdoors during the day, particularly in the morning, to help regulate your circadian rhythm. 10. Limit naps. If you need to nap, keep it under 30 minutes and avoid late afternoon naps to prevent interference with nighttime sleep. 11. Avoid stimulants before bed. Avoid nicotine in the evening, as it can disrupt sleep patterns. 12. Sleep diary or apps. Monitor your sleep patterns to identify factors affecting your sleep quality. 13. Seek professional help if needed. If you have persistent sleep issues or suspect a sleep disorder, consult a healthcare provider or sleep specialist for evaluation and guidance. Several supplements can help improve slow-wave sleep, SWS, and overall sleep quality. 1. Melatonin. Melatonin supplements can help adjust sleep timing, particularly for those with circadian rhythm disruptions. 0.5 to 5 mg taken about 30 to 60 minutes before bedtime. Start with a lower dose to assess tolerance. 2. Magnesium, an essential mineral involved in muscle relaxation and neurotransmitter regulation. Magnesium can help promote relaxation and enhance SWS. Magnesium glycinate and magnesium citrate are commonly used forms. 200 to 400 mg taken in the evening. 3. L-theanine. L-theanine promotes relaxation without sedation, leading to more restorative sleep. 100 to 400 mg taken before bedtime. 4. Glycine, an amino acid that acts as a neurotransmitter in the brain. Glycine can reduce sleep onset time, promoting deeper sleep. 3 grams taken before bedtime. 5. Valerian root, an herbal supplement, often used for its calming effects. Valerian root can reduce the time it takes to fall asleep, increasing SWS. 300 to 600 mg taken 30 minutes to 2 hours before bedtime. 6. Ashwagandha. Ashwagandha may help lower cortisol levels and promote relaxation. Look for supplements standardized to contain 5% with analytes. 300 to 500 mg taken in the evening. 7. 5-HTP, 5-hydroxytryptophan, a precursor to serotonin, which is a neurotransmitter involved in sleep regulation. 5-HTP can increase the duration of deep sleep. 100 to 300 mg taken before bedtime. Start with a lower dose to gauge effects. 8. Chamomile. Chamomile can reduce insomnia symptoms and promote better sleep quality. 200 to 400 mg of chamomile extract or 1 to 2 cups of chamomile tea before bedtime. 9. Coenzyme Q10, CoQ10, an antioxidant that plays a role in energy production within cells. CoQ10 improves sleep quality and reduce fatigue. 100 to 300 mg taken daily, preferably with food. 10. Zinc. Zinc helps improve sleep quality, especially when combined with magnesium. 15 to 30 mg taken in the evening, consider taking with food. 11. Passion flower, an herbal supplement traditionally used for its calming effects. Passion flower helps reduce anxiety and increase the duration of SWS. 200 to 400 mg of extract taken before bedtime. 12. Rhodiola rosea, an adaptogenic herb that helps the body manage stress. Rhodiola may enhance mood and reduce fatigue, leading to more restorative sleep. 200 to 400 mg taken in the morning or early afternoon. 13. GABA, gamma-aminobutyric acid, a neurotransmitter that inhibits nerve transmission in the brain, promoting relaxation. GABA supplements help reduce anxiety and promote deeper sleep. 500 to 1000 mg taken before bedtime. 14. Vitamin D. Adequate vitamin D levels linked to better sleep quality and overall health. 1000 to 2000 U daily. 15. B vitamins. B vitamins, particularly B6 and B12, support the production of neurotransmitters that regulate sleep. 1.3 to 2 mg daily for B6. 500 to 1000 mcg daily for B12. 16. Omega-3 fatty acids. Essential fatty acids, particularly DHA, play a role in brain health and inflammation regulation. Some studies suggest that they can regulate sleep patterns. 1,000 to 3,000 milligrams of combined EPA and DHA daily. 17. Tart cherry juice, rich in antioxidants and natural melatonin. It has been shown to improve sleep duration and increase SWS. 8 to 16 ounces, about 240 to 480 milliliters, taken in the evening. Look for unsweetened juice for best results. 18. Holy basil, an adaptogenic herb used in traditional medicine for its stress-relieving properties. 300 to 600 milligrams of extract taken before bedtime. 19. L-tryptophan. L-tryptophan supplements improve duration by increasing melatonin production. 500 to 1,500 milligrams taken before bedtime. Start with a lower dose to assess tolerance. Individual responses can vary, and it's advisable to consult with a healthcare provider before starting any new supplements, especially if you have underlying health conditions or are taking medications. This video is intended to provide health information. If you have a medical condition, please seek professional advice. Thanks for watching. Please subscribe, like and share. Your support is my biggest motivation.